Once again, this is Dr. Hatem Al-Aishi from Dr. Hatem Al-Aishi Medical Center in Cairo, Egypt. Goals of treatment of autoimmune rheumatic diseases. The ultimate goal is total tight control of inflammation, like this. This is what we mean by total tight control of inflammation. We doctors call it remission of the disease. We need to induce remission of the disease. Remission of the disease means the disease is not active anymore. You have no more symptoms. We find no more signs of active disease when we examine you, and your investigations show no more active inflammation parameters. With the current knowledge and advance in medicine, control of inflammation can be achievable to variable degrees in the different autoimmune rheumatic diseases. As you can see in the figures, those arrows represent to what extent we are able to control those different diseases. To the extent that we can control the disease inflammation, we can achieve 5 important things, 5 important goals. Relief of symptoms. If you have pain, you no longer have pain, for example. Maintenance of function. You stay functional at your home if you're a housewife, or at work if you're employed, or in your recreational activities. Prevention of disease progression. If you have 5 joints affected, we prevent joint number 6 and 7. If your kidney is affected 20%, we prevent 40% affection. Prevention of complications. If you have joint affection, they should not get deformities. And lastly, maintenance of effective psychosocial functioning. We want to make sure that you are a happy patient or person with a positive attitude and enjoying life and living. So the default happy scenario, the remission scenario, is this. Let's consider that the x-axis here is the time in years since the onset of your disease. 1 year, 4, 8, 12, 16, and so on. And the y-axis is how the disease progresses over time. The green area represents little or no disease progression over the years, which is compatible with near normal quality of life. The light green is moderate progression over the years, which equals disease that is compatible with an acceptable quality of life. And the red area represents troublesome progression. Nobody wants this progression, of course, that causes a crippling or a handicapping disease. Now, our happy scenario is when we prescribe treatment to the patient. With this treatment, with optimal treatment, you have a happy patient who enjoys a near normal quality of life. What if I keep trying to achieve that remission state, but still I cannot reach it? Now, this is a very important part or turn in this video. What if I keep raising medication doses? I keep shifting to new medications. I keep combining medications. We even try agents in the experimental phase, but still I cannot reach this remission state. What do doctors do? You remember this? The ultimate goal is total tight control of inflammation. While the second half of this goal statement is actually missing. The missing part, we need to add it to make our goal more comprehensive and more representative of real-life situations that we will face in daily practice. The ultimate goal is total and tight control of inflammation, bearing in consideration that on our way to get rid of inflammation, we should not get overly excited and dedicated to the extent that we get rid of the patient himself. And I will explain what I mean. Sometimes this total and tight control requires a treatment amount, types, doses, combinations that are beyond the tolerance of the patient's system. And if we insist, we might be doing more harm than benefit to the patient. And this is incompatible with the mission of being a doctor, to help or at least not to harm. In such cases, if doctors were unwise, they would still proceed. But what happens is that doctors negotiate for compromises. So, if we have tight control on one hand, on the left side, and no control on the other hand, on the right side, doctors in that case will negotiate for moderate control. This is the moderate control. In medical terms, the tight control is the remission, the no control is active progressive disease, and the moderate control is low disease activity. Our goal becomes low disease activity. So more real-life goals of treatment would be remission. This is the big goal that we try to pursue. And low disease activity, this is the less than the big goal, the compromise that we sometimes have to accept. I will now repeat the entire concept of remission and low disease activity I just presented, but in a different way that reflects the daily office practice of physicians. The scenario of having a peaceful remission is actually like this. What we prescribe: little treatment initially. Extent of disease control: suppose it's only mild control. The most important thing here is any side effects that happen should be none or mild and acceptable. Now, mild control is not enough. I need more control. So we prescribe more intensive treatment. I achieve moderate control. The most important thing is that side effect wise, the side effects are none or mild acceptable. Now I need tight control, so I prescribe even more intensive treatment. I get my tight control. I will be very happy if I get this tight control and the side effects are none or mild acceptable. So this is the remission scenario, the happy scenario that we pursue. Now, what if that level of treatment efficacy, the tight control, is not being reached, and so I still need to exceed that level of treatment intensity? This is the scenario where we will go for the low disease activity. What we prescribe: little treatment, you get mild control, the side effects are none or mild acceptable. Okay, that's no problem. I need more control. I prescribe more treatment, the side effects are none or mild acceptable. I need more control, more treatment is needed. I prescribe it, and there are no side effects that are troublesome, and the side effects are none or mild acceptable. Now, still I need more control. I want to go to this tight control. It's not yet. I didn't reach the tight control. So I prescribe an even more intensive treatment. But what happens here is that harms outweigh benefits. What happens here is that harms outweigh benefits. I get side effects. So I will accept that level. I will stop at that level of control. This is the low disease activity. So when we go to our curve, the x and y axis, the green area, the near normal quality of life, it was my goal at the start. I tried to do it, but I couldn't, because treatment had to be overly aggressive and I could not bring the patient to that state of remission. So I accept less than the most aggressive treatment, and I have a disease that is compatible with an acceptable quality of life, which is moderate progression over the years. Once the target is achieved, whether it was a remission or low disease activity, it should ideally be maintained throughout the course of the disease. Now, having explained the importance of controlling inflammation and not simply using painkillers in the previous video, and having explained our goals of treatment in a patient with an autoimmune rheumatic disease, we proceed now to the next video, to the types of medications used to treat autoimmune rheumatic diseases.